At 76, I thought I knew everything about aging. I exercised, ate well, and kept my mind active. Yet, something wasn't right. A heaviness settled over me like a thick fog. Simple pleasures that once brought me joy, gardening, reading, even spending time with my grandchildren, suddenly felt empty, meaningless. My doctor quickly suggested antidepressants, telling me it's normal to feel down at your age. But what I discovered later shocked me. My depression wasn't just about aging or loss. It was caused by 5 hidden factors that most doctors completely overlook when treating seniors over 70. And the most alarming one affects nearly 40% of adults over 70, yet is rarely tested during routine checkups. In this video, I'm going to reveal 5 hidden causes of depression in seniors over 70 that are frequently missed by healthcare providers. These aren't just theories, they're backed by research and real-life experiences of people who struggled with unexplained sadness, fatigue, and hopelessness in their later years. By the end of this video, you'll understand why traditional approaches to treating depression often fail seniors, and more importantly, what specific questions to ask your doctor to uncover these hidden triggers. Whether you're experiencing these feelings yourself or caring for an aging parent or spouse, this information could transform their quality of life when conventional treatments haven't worked. Stay with me until the end, because the 5th cause I'll share is not only the most commonly missed by doctors, but it's also the easiest to fix once identified. Many seniors suffer needlessly for years when a simple test and treatment could restore their joy and energy within weeks. I'll also share 3 questions you should ask at your next doctor's appointment that most seniors never think to ask, questions that could lead to a breakthrough in treatment when nothing else has worked. The first hidden cause of depression in seniors after 70 isn't a psychological issue at all. It's hiding in your medicine cabinet. Many prescription medications can trigger depression as a side effect, yet doctors rarely connect these dots, especially when you're taking multiple medications. Consider Margaret, a 78-year-old former school principal who had always been vibrant and social. After starting medication for her high blood pressure, she gradually became withdrawn and tearful. Her doctor diagnosed her with depression and prescribed an antidepressant, which only made her feel worse. "I felt like I was drowning," Margaret told me. "Every day was a struggle just to get out of bed." It wasn't until her daughter, a pharmacist, reviewed her medications that they discovered her blood pressure medicine was known to cause depression in older adults. When her doctor switched her to a different medication, her mood improved dramatically within just 3 weeks. The truth is, many commonly prescribed medications can trigger depression in seniors, including beta blockers for heart conditions, statins for cholesterol, certain pain medications, some sleep aids, even some diabetes medications. What makes this particularly dangerous is that many doctors don't recognize these side effects because they develop gradually. The depression might start months after beginning a medication, making the connection difficult to spot. Think about Thomas, age 74, who started taking a statin for high cholesterol. 6 months later, he began experiencing profound sadness and loss of interest in his woodworking hobby. His doctor immediately diagnosed depression related to aging, never considering that the timing coincided with his body's cumulative response to the medication. What can you do? First, request a comprehensive medication review with your doctor or pharmacist, specifically asking about depression as a potential side effect of each medication you take. Second, keep a mood journal noting any changes when starting new medications or changing dosages. This documentation can be invaluable in identifying patterns your doctor might miss. Remember, never stop taking any medication without consulting your doctor, but don't be afraid to ask questions about alternatives if you suspect your medications might be affecting your mood. The second hidden cause of depression in seniors over 70 might surprise you: undiagnosed hearing loss. Research has found that hearing impairment significantly increases the risk of depression in older adults, yet most healthcare providers never make this connection. I witnessed this with my friend Robert, a 79-year-old retired architect. Over the course of a year, he gradually withdrew from our weekly chess games and stopped attending his beloved symphony concerts. His family worried he was becoming depressed and encouraged him to see a therapist. Meanwhile, I noticed something they didn't. Robert was constantly asking people to repeat themselves. He often missed punchlines to jokes and would sometimes respond inappropriately to questions, as if he'd heard something different. "I'm not sad," he finally admitted to me. "I'm exhausted. Social situations are draining because I'm constantly struggling to hear what people are saying. It's easier to stay home than to pretend I can follow conversations." When Robert finally got a hearing test, the audiologist confirmed significant hearing loss. Within weeks of getting hearing aids, his mood transformed. He returned to social activities, chess games, and even the symphony. This connection between hearing loss and depression makes perfect sense when you think about it. When you can't hear properly, social interactions become frustrating and exhausting. You might feel embarrassed about misunderstanding others. You gradually withdraw from activities, and relationships you once enjoyed. Isolation increases as communication becomes more difficult. Your brain works overtime trying to fill in the gaps of missed conversation. The brain's constant struggle to understand speech when hearing is impaired creates cognitive load and fatigue, which can manifest as symptoms that look exactly like depression. The saddest part: nearly 85% of seniors with hearing loss never get proper treatment. Many dismiss their hearing difficulties as just part of aging without realizing how significantly it's affecting their mental health. If you notice signs of withdrawal, irritability, or sadness in yourself or a loved one, consider asking for a hearing evaluation before accepting a depression diagnosis. Simple hearing aids can sometimes resolve depressive symptoms that no antidepressant ever could. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. The third hidden cause of depression in seniors after 70 is one that shocked me when I discovered it: vitamin B12 deficiency. This essential nutrient plays a crucial role in brain function and mood regulation, yet our ability to absorb it decreases dramatically as we age. When I was 73, I started experiencing unexplainable fatigue, memory problems, and a persistent sadness that seemed to come out of nowhere. My doctor ran standard blood tests, prescribed antidepressants, and suggested I might be developing early dementia. For 6 months, I took medications that didn't help and worried about a future with cognitive decline. It wasn't until I read an article about B12 deficiency that I requested a specific test. The results were eye-opening. My B12 levels were severely deficient despite eating a healthy diet with animal products that contain this vitamin. What I learned was that after 70, nearly 30% of us develop a condition called atrophic gastritis, which reduces stomach acid production. Without sufficient stomach acid, we can't properly extract B12 from food. To make matters worse, common medications like metformin for diabetes and proton pump inhibitors for acid reflux further reduce B12 absorption. The symptoms of B12 deficiency can look exactly like depression and early dementia: persistent fatigue and weakness, memory problems and confusion, irritability, and mood changes, feeling hopeless or sad without apparent reason, numbness or tingling in hands and feet. Consider my neighbor Eleanor, a 77-year-old who had always been the life of any gathering. Gradually, she became withdrawn and confused. Her doctor prescribed an antidepressant and suggested her family prepare for cognitive decline. When her daughter insisted on comprehensive testing, they discovered severe B12 deficiency. After B12 injections, Eleanor returned to her vibrant self within months. It was like watching someone come back to life, her daughter told me. We thought we were losing her, but she was just severely deficient in this one nutrient. What's most frustrating is that B12 levels aren't included in standard blood panels for seniors, despite how common this deficiency becomes after 70. And the standard normal range used by many labs is too low for optimal brain function in older adults. If you're experiencing unexplained mood changes, fatigue, or cognitive issues, specifically request a B12 test. If your level is below 500 pg/ml, not just below the lab's normal cutoff, talk to your doctor about supplementation options. For severe deficiency, injections work better than oral supplements since they bypass the digestive system altogether. The most heartbreaking part? Countless seniors are living with treatable B12 deficiency while being told their symptoms are just aging or just depression, when a simple test and treatment could transform their quality of life. The fourth hidden cause of depression in seniors after 70 is more insidious because it operates silently within your body: chronic low-grade inflammation. Recent research has revealed that inflammation doesn't just affect your joints or heart, it profoundly impacts your brain and mood as well. At 81, my friend James had always been resilient, even after losing his wife of 50 years. But suddenly, he fell into a depression that seemed to have no explanation. "I've handled loss before," he told me, "but now I can't seem to find joy in anything. It feels physical, like something in my body has changed." James was right. Something had changed. When his new doctor ran specialized tests, they found elevated inflammatory markers throughout his body. His previous doctor had dismissed his complaints as normal aging aches and pains, never considering how this inflammation might be affecting his brain. You see, chronic inflammation creates what scientists call sickness behavior, your body's natural response to fighting infection or healing wounds. This includes fatigue, social withdrawal, lack of appetite, and low mood, all designed to conserve energy for healing. But when inflammation becomes chronic, these temporary behavioral changes can become persistent depression. For seniors, this connection is particularly important because inflammatory markers naturally increase with age. Many age-related conditions like arthritis, cardiovascular disease, and diabetes increase inflammation. Gut health issues, which become more common after 70, can trigger systemic inflammation. Environmental factors like poor sleep quality compound inflammatory responses. What's most concerning is that standard depression treatments often fail when inflammation is the root cause. Antidepressants may help some symptoms, but don't address the underlying inflammation. Consider Nancy, age 75, who developed depression after a bout with pneumonia. Unlike her previous experience with situational depression after her husband's death, this felt different, more physical, with profound fatigue and brain fog. When her doctor tested for inflammatory markers, they were significantly elevated. An anti-inflammatory protocol improved her depression when antidepressants hadn't helped at all. If you're dealing with unexplained depression, especially if you also have conditions like arthritis, cardiovascular disease, or frequent infections, ask your doctor about testing inflammatory markers like C-reactive protein, CRP, and interleukin-6. Simple dietary changes, targeted supplements, and physical activity can often reduce inflammation and improve mood when traditional antidepressants haven't worked. This connection between inflammation and depression explains why many seniors find their mood improves when they address inflammatory conditions, even when they weren't initially focused on mental health. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. The fifth and perhaps most commonly missed cause of depression in seniors over 70 is hypothyroidism, an underactive thyroid gland. This small butterfly-shaped gland in your neck produces hormones that regulate everything from your metabolism to your mood, yet thyroid problems are frequently overlooked in older adults. At 72, I noticed my energy plummeting. Simple tasks exhausted me. My skin became dry, I gained weight despite eating less, and a profound sadness settled over me like a heavy blanket. My doctor ran basic blood tests and said everything looked normal for my age. He prescribed an antidepressant and suggested I lower my expectations about energy levels at this stage of life. For 6 months, I accepted this explanation, believing that perhaps this was indeed just aging. The antidepressants did help. In fact, I felt worse, with increased fatigue and brain fog. It wasn't until I sought a second opinion that a new doctor noticed my other symptoms: cold intolerance, constipation, dry skin, slight puffiness in my face, and ordered a comprehensive thyroid panel. The results revealed subclinical hypothyroidism that had been missed because only the standard TSH test had been run initially, and the lab's normal range was too broad for optimal function, especially in seniors. This pattern is alarmingly common. Standard thyroid testing often misses thyroid issues in seniors because the symptoms mirror normal aging, fatigue, weight changes, dry skin. Standard TSH ranges used by labs are too broad. Many doctors don't test for free T3 and free T4, which give a more complete picture. Thyroid antibodies, which can indicate autoimmune thyroid issues, aren't routinely checked. The threshold for treatment is often higher for seniors despite research showing benefits of treatment even for mild cases. Consider my friend Susan, 79, who was told her profound fatigue, depression, and 15-pound weight gain were just aging. 3 doctors dismissed her concerns before one finally ordered comprehensive thyroid testing that revealed Hashimoto's thyroiditis, an autoimmune condition affecting her thyroid. Within weeks of starting appropriate treatment, her energy returned, the weight began to drop, and her depression lifted. "I got my life back," she told me. "I had accepted that I would feel terrible forever, that this was just what getting old meant. I was wrong." What's most frustrating is how simple the solution can be once properly diagnosed. Thyroid replacement therapy is inexpensive, generally safe, and can be life-changing for seniors suffering from undiagnosed hypothyroidism. If you're experiencing unexplained depression along with fatigue, weight changes, dry skin, cold intolerance, or constipation, ask your doctor for a comprehensive thyroid panel including TSH, thyroid-stimulating hormone, free T3, free T4 thyroid antibodies. Don't accept normal for your age as an answer if you know something feels wrong. And remember that the normal range on lab reports may not be optimal for you as an individual, especially after 70, when thyroid function naturally changes. Now that you understand these 5 hidden causes of depression in seniors after 70, medication side effects, undiagnosed hearing loss, vitamin B12 deficiency, silent inflammation, and hypothyroidism, take a moment to reflect on your own experience or that of a loved one. If depression has been diagnosed but treatment isn't working, or if sadness and fatigue have been dismissed as just aging, consider whether one of these hidden causes might be the real culprit. The truth is, clinical depression certainly exists in older adults, but too often these underlying physical causes are missed, leading to unnecessary suffering that could be resolved with proper testing and treatment. Think about it. How many seniors are taking antidepressants that can't possibly work because they don't address the root cause? How many are told to accept the diminished quality of life when simple interventions could restore their joy and energy? At 76, I've learned that advocating for proper testing is essential. Don't be afraid to ask questions, seek second opinions, or request specific tests if your concerns are dismissed. Remember that you know your body or your loved one's patterns better than any doctor who sees you for 15 minutes during an appointment. Depression isn't an inevitable part of aging. While life changes and losses certainly affect our emotional well-being as we grow older, persistent depression almost always has underlying causes that can be addressed. Whether it's adjusting medications, treating hearing loss, supplementing B12, reducing inflammation, or optimizing thyroid function, there are concrete steps that can dramatically improve quality of life. The goal isn't just to live longer, it's to live better, with the energy and joy that make life meaningful at any age. Thank you for joining me today. I'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you or someone you love is struggling with unexplained sadness, fatigue, or loss of interest in life after 70, I hope this video has given you new avenues to explore. Remember to ask about these 5 hidden causes at your next doctor's appointment. It could make all the difference. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. In our next video, we'll be discussing the surprising connection between sleep quality and cognitive function after 70, information that could help protect your brain health for years to come. Thanks for watching, and I look forward to seeing you in the next video.